I think the big question for this roundtable was not just how we deal better with cases of clinical negligence and error for the sake of the patients, but also whether that can be turned into a learning experience which can go into the system.
It's clear that we're all dealing with the same issues professionally and personally and within the field of medicine, and there is something very reassuring about that. I loved hearing other women's perspectives on their caseloads and their practices and the experience that they've had in the law.
Women's health is more in the public eye at the moment. There have been more mentions of it in Parliament, and also generally women being heard more about how they're not being represented correctly and how they are being overlooked. ARAG and the laws want to make sure that we bring this to the wider attention of more people.
We always put the patient at the heart of everything we do, and also not just on the claimant. We spend a lot of time with clinicians and NHS trusts and healthcare organisations to make sure staff feel supported. And so we do our best to support both sides, the NHS trust, the clinicians, but then also trying to make the process as easy and as swift for the families or the women who have been harmed.
I think there's a lot of focus on women's health in relation to maternity. I think there are other aspects of women's health more generally which are also problematic but have received less attention, and potentially that could be a problem for the future.
We are not making much progress or enough progress on dissemination of knowledge and lessons learned as yet, and there is a lot to be done in the NHS for that.
I'm not wildly optimistic that there will be better care in the future. I've been doing this job a very long time, and the same issues seem to be coming up time and time again that have been coming up for more than 2 decades.
I'm not convinced that the numbers of clinical negligence claims are going to go down, not until there is a wholesale change in the way that healthcare is delivered in this country.
I mean, there's always a time lag with these things, aren't there? We've been finding out terrible things which happened in the past, sometimes in trusts which, as a result of what happened in the past, they're already doing things better at. But again, given that time lag, the way in which that can feed into a better way of doing things, I think is a massive issue for policymakers, and it hasn't been grasped.